Great. Well, we'll jump in. I'm Ryan Langdale. I'm a principal with the Chartis Oncology Solutions practice. I'm joined today by Dr. Doug Flora, Executive Medical Director of the St. Elizabeth Healthcare Cancer Center. Doug, thank you for joining us. I think by way of preamble, patients need intelligent healthcare now more than ever, and that's what St. Elizabeth's is delivering in the northern Kentucky and greater Cincinnati area with its new cancer center that's opening as we speak. And so, interested in a little bit of your background perspective on what made St. Elizabeth's decide to invest in a cutting-edge cancer center.
Yeah, well, we obviously, you know the system well, Ryan. You've come and worked with us. We are sort of at ground zero for cancer in the country. We're worst on the list in terms of all available states for lung cancer diagnoses and deaths and stage at diagnosis. Number one for colon cancer as well. And we rank pretty highly in terms of poor performance for a lot of other cancers. So obviously we recognize the need, and that's part of why we built the new place.
Thanks, Dr. Flora. And as you think about what you've built, and we can see it there in the background behind you, being in the new space, what's special about this cancer center relative to others that you've seen around the country?
I got free reign here, and our teams are really dedicated to what we're calling whole person care. My board bought in, our senior leadership bought in, our community bought in, our business leaders. And so what we've really been able to design is more of a seamless experience from the very moment that a patient receives their diagnosis through bereavement or survivorship in one setting.
Well, it's certainly a unique time to be opening the doors in the midst of everything that's gone on with the COVID-19 pandemic. And as you and I have talked about previously, there are a lot of patients who have chosen to put off care, preventative or treatment, and are choosing alternative ways to receive their care. What is St. Elizabeth's doing to make sure that patients get the right cancer care in the right place when they need it?
I think primary for me is maybe the guy who's out in front is getting the message out that we're safe and we're clean and we're open. We've seen screening levels drop off to historic levels in terms of breast and colon and the more elective procedures. And obviously that was fine in March and April when we were trying to minimize exposures to the virus for at-risk people. But now we're starting to lose significant numbers of people 5-10 years from now for lack of screening and stage migration. So it's been a big push in our center to get them back in here as quickly as we can on schedule.
And is screening and prevention and diagnostics a big part of the cancer center? People typically think about that as being treatment focused.
Yeah, that's a good question. That's where we were trying to shift the paradigm to find the cancers in the earliest and faintest footsteps. So we built a Center for Precision Medicine and Genomic Health that's testing 100% of patients with breast, ovarian, pancreas, and advanced prostate for genetic mishaps. We've got a gigantic lung cancer screening program that's approaching 14,000 scans now. All of this is trying to find the patient when they're fixable.
Great, thank you on that. We've been with you for most of the journey here and kind of understand that creating a cancer center is a complex and time-consuming process. What was key in your effort to keep that process focused and successful and manifested this week in the opening of the doors?
Well, our engagement with you, obviously, and you and I have developed a good friendship, but also a mutual respect. And what I think you guys were able to deliver to us was architecture. Our work, you did a deep dive and then came in and told me more about my building than I knew. And then you were able to help me design and our team design the structure by which we would start to impact change. Designing pillars and strategic plans. It's really nice to have a scaffolding to follow when you're the builder.
Great. Just a couple more questions. I'm interested in what you learned along the way that surprised you most about the process of planning for and building and operationalizing a cancer center.
I think where we learned the most was when we actually asked our patient, when we asked the consumer and listened to their voice. The things that they valued weren't necessarily the things that I might have identified as a cancer doctor. For instance, we were talking about educational seminars in a big educational room that we're building. And the Patient Family Advisory Committee, the topic list was things like, how do I tell my kid I have cancer? Which obviously is gut-wrenching and important. And we would have missed that had we not asked the right questions of the right people. So for me, learning from the patients was really important as we work through this process.
And is that a group that you keep engaged on an ongoing basis beyond sort of the design for the center itself?
We do. And actually, I'm hoping to expand it. My vision is that someday it's like the PTA for your kid's school. We might have 300 people in a closed Facebook group and a steering committee of leaders. We did include a lot of the patients on interviews for staff as we're filling in this new building. There were actually former nurses that are now patient volunteers that are interviewing incoming staff to make sure they have the right stuff.
That's great. Got one final question for you here and see if we missed anything, but as you think forward 5-10 years, how do you envision the new cancer center is going to impact the community and in its fight against cancer as you sort of look forward?
Well, I think for us, the goal here is to improve health literacy for our community. I think the difference between cancer centers in 2005 and cancer centers in 2020 is that we need to get out of our own building. You know, we have to teach the community that obesity and alcohol abuse and tobacco are modifiable behaviors that cause cancers. You know, we need to really introduce screening to be part of the norm for people, especially our male patients or persons of color or persons who are socioeconomically disadvantaged. We've done a poor job getting to them. And so as we start to build around here, that's what we're working towards.
Dr. Flora, I appreciate your perspective on this and your time, and good luck as the Cancer Center's doors open this week and in coming weeks.
Thank you, Ryan.